Hi, I'm Dr. Doug Weiss, and I'm excited to talk about sex addiction recovery in Australia. I'm going to introduce to you an expert in the field of sexual addiction in Australia who's been trained and certified in sexual addiction. And although she's a woman, she knows exactly what to do with male or female sex addicts and partners. So I want to introduce to you Dr. Faye Sayed. Nice to see you, Faye.
Nice to see you. Thank you.
And I'm so glad you're here.
I'm very glad to be here.
Now, you work with sex addiction in Australia. Okay, so let everyone know, what's the name of your organization?
House of Hope.
House of Hope.
Yes.
Okay, and they can contact you in Queensland?
They can, yes, I am in Brisbane, Queensland, Australia,
okay.
Yes.
And they can Zoom you, they can call you,
yes.
They can Facebook you probably. They can also come in and do intensives because you're trained to do intensives over there.
Absolutely,
Now
yes.
explain a little bit. I think everyone knows what telephone counseling is. You call in Zoom counseling, but I'm not sure everyone knows what an intensive is for sexual addiction. So explain that. What would that look like?
So the intensive training is for some people who want to actually get to the bottom of their crisis and benefit from the recovery in a short amount of time. And then we offer them 3 days and 5 days. And also for some people who've got short time, I have got the weekend.
Okay,
I've got 2 days. It's very compact, but it's doable.
It's doable. And, I've been doing intensives. I've actually created the intensive process. And so we've been doing them for over 25 years. And so I know they work. I've seen the miracles. I've seen men really get a head start in the recovery. Women start being able to deal with the grief, the anger, the hurt, the trauma of sexual addiction, which is real for partners, and actually work on their marriage at the same time. And that's the beauty, I think, of intensives, is they can work on all of it. He can actually find out what type of sex addict he is, what he needs to do to get better, if it's him. I mean, sometimes there are female sex addicts too. I'm not minimizing you lady sex addicts, okay? But generally, the men are the ones coming in. And the wife can really get starting a plan for her recovery and also get ongoing help and get a treatment plan. Is that right?
Absolutely, yes, absolutely. And I have learned all this through ASAT training. And then I didn't know that it was possible. I thought sex addiction, any therapist could do sex addiction therapy. I was wrong.
Oh, yeah.
I was wrong because sex addiction is a different beast.
Well, I did an interesting research project once. And so, and you can do this in Australia, but I did this here in America. I just picked 5 or 6 top cities, and I typed in sex addiction help or sex addiction treatment or therapy. And then I went on their webpage to see if they were certified, trained, anything. And what I found out is most therapists will throw out all kinds of stuff that they treat, but they're not trained in it. Over 93, 95% of them had no training who advertised to treat sex addiction. Now, I know you've been thoroughly trained. You went through the ASAT sexual addiction, the partner betrayal trauma, the intimacy anorexia, which we'll talk on another show. But this is so important.
It is.
For the addict, because so many of them go get help and they're told things that don't help them. And so many partners are told things that don't help them.
Yes.
And some trainings are actually antagonistic towards the partner, which the way you've been trained, you're supportive of her. Tell us a little bit about when they come in for an intensive for you, you're going to see him individually, her individually, them together. How does that work for them? So they know what that looks like.
Yeah, so I see her first individually, and then I see him individually, and then together.
Okay, good.
Because sex addiction, recovery, as you know, recovery occurs inside the relationship. So it's very important that they are seen together.
Absolutely.
Yes, and yes, as you said, other therapists claim that they can treat sex addiction. And I get those clients, actually. They come to me years later.
I know.
They have spent thousands of dollars.
Yes.
And they come to me in a big mess. And,
yes.
But ASAT gives you the structure because sex addiction recovery needs a structure.
Absolutely.
And it works.
It does work. And I've of course, we've been doing this for over 35 years, so we know it works. But what you're talking about, I've cleaned up a lot of messes for men and women who've sought real help for sex addiction. When you seek help for sex addiction, you're in pain. You feel like no one can love you. You feel like there's no hope. And then you go to someone and it doesn't give you the tools, the actual tools you need to do recovery and stay sober. And I've been sober for over 35, 36 years now, and it's proven by a polygraph test. So I know it works, okay? And if you're in the Queensland area, if you're in Australia at all, Dr. Faye Seedus, who I would refer you to, I would say, go see her. She's close by, okay? She knows what she's doing. And that's what you really need. When you're in a crisis with sex addiction, you don't need to randomly grab some therapist who maybe read a book. It takes way more than reading a book to treat sex addiction. You could read a book, okay? You really need an intelligent, a mind and heart that understands and can compassionately lead you to a recovery process. And that is Dr. Faye Said. She can do that for you. I'm strongly and recommending, if you're in Australia, to connect with her. Dr. Faye, can you give people your website so they can get all your contact information and all the services you provide and support in your country? Can you please do that? Just look at the camera and give them the website.
Yes, it's House of Hope Counselling and Psychotherapy Center, and we are located in Brisbane, Queensland.
Awesome. Well, thank you so much for being here, and thank you so much for not only dedicating yourself to train yourself to help people, but to really have a heart to do it and to help these people actually see what recovery can look like. You know, that's a gift, and your country really, it's awesome that you do what you're doing, and I'm hoping that just thousands and thousands of people get help while you're doing your work. Thank you so much.
Thank you very much for having me.